Hey y'all, John Hart here, and welcome back to Mr. America Hart. We all get to experience the fun part of bodybuilding, whether you're a competitive bodybuilder or you're just in the gym trying to build big muscles, look good for the beach, whatever it is, okay? If you lift weights and do it a little bit serious, you're a bodybuilder, all right? And the fun part is, of course, growing the muscle, of course, changes in your body. And then we all get to experience at various times some of the slightly negatives, which is no matter how you work out, no matter how you train, you are not immune to having some challenges along the way. If you train hard enough, there's going to be some challenges in certain parts of your body. And that's just simply because of certain patterns built up in our bodies. And gaining an understanding of them is really important in getting through it so you can get back to being pain-free and fit and ready to go ahead and hit the gym hard again. So, I have a special guest today coming on the show, and he happens to be my longest term friend and close to my heart, very close. Dr. Mike Remy. You've heard me reference him many times in the past on various videos that I've done as being one of my favorite YouTube sites to go and visit if you want to get your body healthy, all right? And so even if you don't have an injury right now, I'm saying this to you right now, you watch this video all the way through, number one. And then number two, because there's so many nuggets all the way throughout this video. But then number two, go ahead and save this video because someday you're going to need it. You may need it, I should say. I don't want to project that onto you, but you may need it, all right? And there we go. So I'm also going to just let this interview that I did with Dr. Mike run straight through from beginning to end. And I'm talking about unedited. It was kind of fun, and you'll see what I mean as we go. We have a little bit of back and forth going on at the beginning and the end of the video that's kind of special, and you get to see a different side of both myself and Dr. Mike, a little bit more relaxed and maybe even some would say unprofessional. But that's all right. We're just going to roll with it anyway. It's my channel. I can do anything I want, right? So stay tuned. Here we go. Welcome, Dr. Mike Remy. Here we go.
Mike will pick up everything. Recording audio through our mics. Perfect. How are you sitting in this chair, Mike? It leans forward, man.
That's the whole idea.
All right.
It creates an anterior pelvic tilt, which decreases posterior disc pressure. Now let me say, yeah, okay. So you're a little taller than me now. You're in a position of control.
Am I taller than you,
and
though?
Command. Yeah.
But this is going in outtakes. Okay, so
all right. You're
I face them.
you're definitely in a position of command right now. That's good. You're a little taller.
but I'm in your space, though. You know.
You notice I gave you my chair too.
Yes, you did.
I put you in the captain's.
You did.
So let's
You did.
rock and roll. What do you want to talk
All
about?
right. All right. All right, guys. Welcome back to Mr. America Hart. John Hart, of course. And today, I have a special guest for you. Take a look at them, okay? I have a special guest for you, okay? I've mentioned Dr. Mike to you all before. Now, Dr. Mike Remy, I'm going to give you a quick breakdown of of what I know about Dr. Mike from my perspective, and that is Dr. Mike was one of my first training partners of all time. When I started bodybuilding, we were both 18. About 18.
19, somewhere around
We're the
there.
same age. I think he's a few months my senior. So he's 60 and a few months older than I am. But we were original training partners. We tore up Olympic Health Club in Hicksville, New York. It's one of the original bodybuilding gyms on Long Island. And we were going at it, just having a great time. And what a great experience it was for me, as a bodybuilder, starting out with one of the hardest training partners I could ever have. And Dr. Mike went on to become a chiropractor. And I've mentioned him specifically because of that, okay? So I'm going to let him carry the story on. From that one point on, I left New York, moved to LA, left my buddy, my great training partner behind, although I wish I've tried to bring the band back together again since then. You know that's true.
Yes.
And when I left him, I'm going to let him take over from here, how he went on from bodybuilding. Just a quick 1 minute, just how you went to chiropractic, what turned you on about it, and then what kind of special qualifications do you have these days or certifications that you can enlighten us. So I'm going to carry it on from there. Go.
Okay. So John and I, believe it or not, he left this part of the story out. we both desired to be chiropractors when we were 18, 19 years
that's
old.
true.
You forgot about
I
that.
forgot. Yeah.
Not that that's where we met, but that's how it began. A lot of intense
True.
training. I would say he's probably the most intense training partner I ever had, especially leg training and back training, which back in the day
Thank you.
was his big thing.
Yeah.
I got into lifting very early on in my life, probably as a young wrestler in junior high and high school. I hurt my back, but I loved lifting, so much so that from all the tremendous leg presses and heavy squats that I did, I wound up at around age 21 in a clinic where they x-rayed my back and invited, I would say, at least 8 to 10 different doctors in, because they had never seen such a degenerative spine at a young age. They said, this is a spine of an 80-plus-year-old on a 21-year-old kid.
Wow.
And they told me basically that I should not be lifting anymore and that I was pretty much bound to be disabled at a certain point in my life. So I decided to change a few things in my training program, but I still yearn to train very heavy, which I still do now as a 60-year-old. And I was able to beat their predictions. I went back to competing, went back to heavy training, bodybuilding, won my trophies, retired a long time before John did from the posing platform. But I've gone on to study more specialties than a typical chiropractic degree, including what's called chiropractic orthopedic degree, which is a subspecialty in chiropractic, learning about orthopedic disorders and how to conservatively, through manipulation, exercise, soft tissue work, help people through their problems without surgery. And I also became a certified chiropractic sports physician, which is another subspecialty in chiropractic. So I've worked a lot with athletes, people that are into working out and trying to help them get over chronic injuries by combining rehab, soft tissue work, and chiropractic care.
Now, let me interrupt this part of the story here. You wrote a book.
About
several.
13 or 14 books at this point.
Exactly. So why don't you share a little bit about that and your program?
It all started out with me identifying that both in my own body and many of my patients, that we all have musculoskeletal asymmetries and weaknesses and joint instabilities. And these are many times the root cause of our injuries and our pains. And most people are not either identifying or correcting these. So I studied from rehab experts in Japan, Australia, New Zealand, America, Europe, and I tried to learn as much about rehab as I could. And it paid off because I started a system called Posturesize, which was an exercise system to identify posture and movement disorders in people and how to use corrective exercises to correct them, and then plug that into training so you could go back to training without hurting yourself. And then that developed into all kinds of books about shoulder injuries, one on knee injuries, several on low back problems. I even developed a program to train trainers, which I did for several years, train personal trainers in injuries and how to identify these problems, these mechanical problems. And that's the bulk of what I do today to help people.
So now what I'm going to do is I'm going to put the link down below in the video description for Posturesize specifically, and any other links Dr. Mike wants to share with y'all that maybe gives them greater access to all of that material at some point in time, right?
The basics of it now, Posturesize kind of evolved into painfreeandfit.com. So I realized that not many people were into changing posture necessarily. So although that was a big part, maybe 20, 30 years ago, of the practice and the name Posturesize,
Right.
I kind of morphed that into, I would say, Pain-Free and Fit.
Pain-Free and Fit.
Which is the basis of everything I do now.
And now you have a YouTube channel.
I have a YouTube channel for the last 5 or 6 years, over 300 videos on injuries, a lot of especially low back stuff, but we also have shoulder, knee, neck things. Learn how to, the concept is how to give you tools to help self-rehab your problems. It's always better to work with an expert that can guide you through an analysis of your body and what your problems are and their corrective exercises and how to do them. But a lot of people don't have access, whether it's a financial situation or a geographical location. So I put these together so you can learn how to do an analysis on your body, figure out what your muscle imbalances are, your joint instability problems, posture movement tendencies that are adding to your problem, and then corrective exercises and how to build a tailored custom program for your body that's going to be different, because the corrective exercises I need are going to be different than yours. Just because we've both been diagnosed with, let's say, a rotator cuff tendonitis or a medial knee meniscus problem, the exercises and what you're going to do in the gym and how you're going to walk and how you're going to bend your knee, it may be entirely different based on what's stressing that medial meniscus.
So tell me this, is your practice, or do you find that all of the techniques, all of the systems you've developed, I'm using generic terms here, okay? The things you just described, do they apply strictly or mainly for the 50 plus crowd, or are there actual 20-year-olds? You mentioned yourself at 21. Now I was already gone, so I don't know what you were doing once I was gone, but you were squatting and deadlifting just fine when I was training with you, okay? And you didn't destroy those things in your back when you were training with me. But beyond that point, you mentioned yourself at a young age having back problems, back issues at that age. So what do all these things apply to even the younger guys? Because my audience here, you have to understand, on my channel, the bulk of my audience separates into two groups. 24 to 44 is the majority. And then I have another group, 54 to 74 or so, who obviously have a lot of interest in these type of things because they've lived a life. But what about the younger guys?
So here's the bottom line. No matter how old you are, it's rare to find someone who has a perfect musculoskeletal system in terms of working mechanically the right way. And the reason that is because we all have developed stronger sides and weaker sides. We all have habits that we cross one leg more than another. We sleep more on one side than another. We turn or look to one side. We're driving a car and our right knee comes up more than our left. We've all developed these asymmetries. So depending on how long that damage has slowly been building up, and usually most people's chronic problems aren't due to one slip or fall. Sometimes they may think it is, but it's really a building up over a lifetime, kind of like a cavity. It doesn't start as a full-blown problem. It builds slowly at a time.
Great analogy.
So I've had people that are teenagers, kids that are gamers that are in elementary school that need posture and movement.
Posture all day long.
Exactly. Oh. And right from the word go, even before you're born, when you're growing in the womb, your fascial system, your musculoskeletal system, your neurological system is setting in patterns of how you're holding yourself, how you're moving. And as time goes on, you have these repetitive patterns that add up. And typically, the more distortion you have, the earlier on in life you're going to have injuries and problems. The less distortion you have, it may not show up till you're in your 50s, 60s, or 70s. But the mechanical corrections and the exercise and learning about your body and how it works and how you can change it to serve you better, not only avoiding injuries, but when you're working with good mechanics, you're going to have greater force output for your workouts. You're going to be able to make greater gains. It applies to any age whatsoever.
So one more question, because I know we're going to not go too long today. In our discussions, we're driving around all this week. I'm over here in New Jersey, New York, doing some collaborating. So I'm doing with Dr. Mike today. But when we were driving around the other day, you mentioned to me, I mentioned a client with an MRI, an X-ray, and I'm doing it again. You guys have seen me do this. I mean, he opened up my thinking to a whole other zone with one simple comment about the MRI being a picture, but not necessarily the whole story. So please share what you said to me, because some of you guys out there, I know, have already had that diagnosis. You've already gotten the picture. You've already gotten the recommendation. You've already gone for your second consultation, maybe even your third, prior to deciding on, are you going to go to surgery? Maybe you already had surgery. But Dr. Mike, first of all, most of the chiropractors I've known over the years, most of them, because I've ended up with really great ones over the years, they weren't just chiropractors, okay? And I don't like it when people categorize them as just chiropractors. This man right here has a holistic view of training and the body and how to get pain-free and fit, as the title goes, right? But please share with them, in this case, how your view of MRIs, X-rays, and more of the whole scene.
I think in a nutshell, what we were discussing yesterday isn't just my view, by the way. This is...
And how it can help them.
Right. This is when I say contemporary view, over the last 30 plus years. I mean, this view was even when I went through clinic and I was in school. Now that's 35 years ago. The biggest mistake people make that have injuries is trying to think of their injury as only a finding on an MRI report or an X-ray or a specific diagnosis of an exact tissue. For instance, I have a medial meniscus tear that's been shown on MRI. And the doctor who looks at me, unfortunately, because of our modern healthcare system and rising insurance costs, and doctors need to make a lot of volume in a short period of time to make a living, what they're schooled in years ago, which is to combine imaging studies with a good clinical exam, meaning they're grabbing your knee and examining it, twisting, pushing, doing orthopedic tests on it, feeling where the problem is, and then analyzing your mechanics, how you're moving, how you're squatting, how you're walking, combining that with your story, your case history. So there's three things: the patient's case history, the physical exam, and the imaging studies. They should all be coalesced together to arrive at an accurate diagnosis. And as I said before, the mistake is you think one anatomical tissue is the problem. Let's say a medial meniscus tear. But in reality, you could have 5 different people with medial meniscus tears, and there's 5 different ways of treating them based on their unique problem. John, what I think opened your eyes yesterday is when I made the statement, it's been known for decades now that if you take an MRI of knees of 100 people, just give them off the street or bring them in from the clinic, if you take 100 MRIs of people, half of those MRIs are going to show damage to the meniscus, and those people are not even going to be cognizant that they've had any pain in their knee.
No symptoms.
No symptoms at all. You can do x-rays on spines and hips. You can do MRIs on shoulders and find rotator cuff tearing and fraying, and patients have had no symptoms. So the mistake is both doctors and patients are thinking that the imaging study is the whole situation, that that's my diagnosis and that's what we have to do, go about to treat. But yet when you ask a patient and get into it, does your shoulder hurt you all the time when I raise it up? Well, no, but if I raise it with this particular activity, or if I go to this amount of weight or resistance, it's what hurts. You have to delve in deeper, meaning that there's usually a mechanical component to their problem, meaning that they're not holding their shoulder in the socket the right way. There's an asymmetry that's developed in the various rotator cuff muscles and the scapular muscles that comes out under a certain load, under a certain level of resistance that causes symptoms. And whether you have surgery, the best chiropractic adjustment, the soft tissue care, that's you feel great getting off the table, you go back to the gym and the pain comes back, it's because someone's not addressing the mechanics in your body. They're not training you how to hold that joint, how to stabilize it, what muscle to engage or what muscle to disengage to create a balanced state in the joint.
Now I came here and Dr. Mike just threw me down on the table and let's see how you're doing like this, and interviewed me as I'm going, right? And I told him lately there was a little bit of a shoulder, a little niggle in there lately, right? And so within minutes, he accurately was diagnosing what in my mind intuitively, I kind of had an idea of what was going on. And so are you available? I'm going to ask the questions because now everybody's out here is going to go, are you available? I know that you're in New York. I know you're located, your office in Long Island, a few days a week. But are you available for any consultations online?
Yes, I do Zoom consultations Monday through Wednesday. You probably need at least a 2 or 3 week lead in to find you an appointment in the schedule, but I do them. Now, granted, we can do a lot through Zoom if you're interested in online consultations, but it's always a tad better to go to someone that does rehab or advanced rehab therapy who knows how to analyze mechanics and have them physically feel your body and go through it. Because I can pick a lot up off the camera. Sure. I've been doing it for years now with patients and online clients, and we can get a lot of good work done, but it's usually better if you can come in person. So if you can find someone locally to you that's really versed in rehab, who knows how to do soft tissue therapy, who really knows how to check mechanics as it relates to joint stability. It could be a chiro, could be a PT, could be an osteopath. Sometimes it's a personal trainer with a high level of education. But learning what your movement patterns are, what your posture distorts, to feel the joint as you're exercising. If you're having problems with, let's say, bench pressing, you should be able to analyze that joint while you're pressing at the bench to really see what's going on as you're doing the motion. Okay,
well, great, fair enough. So very appreciative of you for pointing out that, so it's not a money grab, guys, you understand? I'm pushing him to let you know he does consultations. So if you don't have somebody in your area that you've already searched and looked, or if you just want to get a hold of Dr. Mike, We'll put your contact information down below, right, for email. If you want to get a hold of Dr. Mike and maybe find out what you should be asking or searching for specifically, right?
That's the other point of it. An online consult, sometimes we can figure the whole thing out just with a Zoom consult. Sometimes I will encourage or direct an online client to have a certain test done, to have a physical exam done, something else besides what we can do online.
Good.
But usually we can still make a lot of progress online.
Right. So he's a man of order. Okay. So that's the one thing I appreciate about Mike. And also the fact that he's a man of integrity. So Mike, I want to thank you today, doctor, for giving us your time on Mr. America Heart. I know you guys get a hold of Dr. Mike. He'll be happy to help you out. He's got a big heart to help people out and spread the word as well. So feel free, look down below in the video description again before we go.
Is that as hard as you can shake a hand?
No.
I mean, you are a former, well, listen, you are a Mr. America winner.
Yes.
And I always address my old friend as Mr. America. Now, come on, let me see the forearm.
I got
You've been working forearms
I got
and grip
it.
strength?
I have been. And a little grip. And a little grip too.
It's getting there.
It's getting there. I'm just ramping up, though.
It may not be up to what I'm expecting. But you need a ramp up? We've definitely got to train type 2 explosiveness.
I'm getting red in the face here. He's got the leverage on me and the unexpected attack right there. Man. All right, Dr. Mike, thank you so much. We really appreciate you once again.
Buddy.
We'll see you next time. Maybe we'll get Dr. Mike back on a Zoom with us. That's it, brother. Really appreciate you. God bless.
My pleasure. I hope that this information can help all of you in some degree.
All right. Thank you. And listen, before you go, I'll be put in the middle right here. When you see that disc pop up, that's the subscribe button for my channel. Please give that thing a tap. Let YouTube know when I have new videos pop up that you want to go ahead and see them and be notified of them. And then I'll put a couple boxes up here maybe for some upcoming videos you can check out for yourself. All right? See you guys later. From my heart to you, John Hart. That's it, brother.
All right. Good job.
We flowed right through,
Put
man.
a little humor in it.
We did. That was really good. Not bad.